we fear for our own safety.
Whitby, Ontario resident Lamo Dolkar worked as a frontline nurse during the early months of the pandemic. She says it's always been a stressful job, but even more so now with the constant threat of COVID-19.
I personally, when I came home, I would be in the garage, stripping down, putting alcohol on myself, then going up and, having a shower before I could even hug my kids.
Canadian research published today suggests there were high rates of stress and burnout among healthcare workers even before the pandemic. Roughly 65% of physicians who responded to a hospital survey in 2018 and 2019 reported recent burnout. So did roughly 73% of allied health professionals like therapists, pharmacists, and social workers. Nurses had the highest reported rate at nearly 78%.
The levels of burnout were very high in my view.
This Toronto physician says his findings are from one facility but reflect a broader trend in healthcare.
If it was that bad before, what's it going to be now?
The research team hopes to remeasure burnout rates mid-pandemic, given the ongoing strain on Canada's healthcare system. Personal support workers, paramedics, and physicians are all among those now coming forward about worsening stress.
We really need to remember that physicians are people, which means that we've all been struggling with the same issues that the general public has been.
But for healthcare providers, that can also impact patient care.
If a nurse or a physician is burned out, it's much more likely that the patient they're taking care of is going to have some sort of adverse event.
It's just a vicious cycle that's ongoing, that's affecting patient safety, that's affecting our safety.
Dolkar says more supports are needed for healthcare workers since the stress of this pandemic isn't over yet. Lauren Pelly, CBC News, Whitby, Ontario.